Have you ever stopped to think about the bizarre ecosystem existing right now, hidden inside your favorite sneakers? Steel your stomach, because we are going to dive into a damp world of fungi, bacteria, and deformities that might be silently destroying your skin while you watch this video. Leave your like right now at the beginning and get ready, because you will never look at your feet the same way again. Number 1. Onychomycosis. That yellow, thick, and deformed nail look isn't just an aesthetic problem, it is a living colony of fungi feeding on your keratin. Over time, the nail structure becomes hollow and starts to crumble as if it were old, rotten wood, releasing a characteristic odor of organic decomposition. It is a stubborn infection that hides under nail polish or in the darkness of the shoe, turning something that should be clean and rigid into a deposit of dead and contaminated matter that can take years to cure. Number 2. Athlete's foot. Imagine the sensitive skin between your toes turning white, extremely damp, and starting to fall apart into soft, mushy pieces. This is tinea pedis, a classic fungal infection that causes hallucinating itching and leaves the area raw, stinging violently with every step you take. The hot and stuffy environment of your sneakers is the perfect holiday resort for these fungi to multiply rapidly, creating painful fissures that serve as a wide-open gateway for even more dangerous bacteria. Number 3. Cheese smell. That foot odor that sets the room on fire and makes people turn up their noses when you take off your sneakers isn't just sweat, it is bacteria excreting gaseous waste. They feed avidly on your dead skin and accumulated sweat, fermenting in there and releasing gases that chemically resemble rotten cheese or strong vinegar. This odor is a clear sign that the bacterial population on your feet is completely out of control, turning your sock into a toxic laboratory of nauseating smells. Number 4. Ingrown nail with granuloma. When the nail is cut incorrectly and grows sideways, it punctures the soft skin, creating a constant open wound inside the tight shoe. The body reacts by creating a granuloma, that red, pulsating, and moist proud flesh that bleeds at the slightest touch and prevents you from walking or wearing anything. The pain is piercing and continuous, and the infection almost always generates accumulated pus on the sides, often requiring painful surgery to rip out the nail matrix and clean the rotting area. Number 5. Plantar wart. Popularly known as a fisheye, this isn't a simple callus, but a benign tumorous lesion caused by the HPV virus that grows into the flesh of the sole of the foot. Looking very closely, you see black dots in the center, which are clotted blood vessels feeding the virus that is living and pulsating there. The sensation when stepping is compared to having a sharp stone inside the shoe all day, and if you pick at it, the virus spreads, creating a constellation of painful warts. Number 6. Hard and cracked calluses. Constant footwear friction creates hard, dead skin that, without proper hydration, loses elasticity and begins to crack deeply like dry earth in the desert. These fissures in the heel can open crevices that reach living layers of the dermis, bleeding inside the sock and making the simple act of standing a torture. Besides the appearance of total neglect, these deep cracks are VIP invitations for street bacteria to enter your bloodstream through the dirty sole. Number 7. Jigger, tungiasis. Walking in sandy or dirt areas can bring this tiny flea that penetrates your skin to lay eggs and grow frighteningly in size. It creates a yellow sac with a black in the center, causing an agonizing itch mixed with pain while it feeds on your blood and grows inside you. Removal needs to be surgical and careful with a needle, because if the egg sac bursts inside, it causes a severe and purulent infection that takes weeks to heal. Number 8. Sneakers that are never washed. Your favorite sneakers, the ones you wear every single day and never wash, have basically turned into a dark, hot, and damp biological incubator. The fabric and foam absorb liters of sweat, flakes of peeled skin, and street dirt, creating geological layers of invisible filth where fungi thrive. Putting your foot in there is like wearing a contaminated glove, guaranteeing that any small wound on your foot is immediately bombarded by millions of harmful microorganisms. Number 9. Synthetic socks. Wearing cheap polyester socks or 100% synthetic materials is like wrapping your feet in plastic film, preventing any breathing or natural evaporation of sweat. This creates a greenhouse effect that literally cooks your foot in its own acidic humidity, softening the skin and facilitating the aggressive invasion of fungi and bacteria. The result at the end of the day is a wrinkled, pale, sensitive, and extremely smelly foot, desperately begging for fresh air. Number 10. Walking barefoot in locker rooms. Walking barefoot in the gym shower or on the edge of a public pool is a true game of Russian roulette with your skin's health. The wet floor is microscopically covered by fungi from hundreds of other people, plus wart viruses just waiting for contact to colonize your dermis. It is the most efficient cross-transmission environment that exists, where an infected foot leaves biological trails that you absorb through your pores without even realizing the danger. Number 11. Plantar fasciitis. The first step of the day feels like a stab in the heel, a sharp pain reminding you that the tissue supporting your foot's arch is inflamed and screaming for help. Plantar fasciitis turns the sole of the foot into a taut rope about to snap, caused by repetitive impact and lack of proper support in worn-out shoes. It is an internal inflammation that burns silently, making every step a battle against your own body, limiting your movements and turning a simple morning walk into a painful and punishing ordeal. Number 12. Bunion. It is not just a protruding little bone, it is a progressive deformity where the big toe joint is pushed outward, creating a bizarre and extremely painful angle. The skin over this bony protrusion becomes red, stretched, and inflamed by constant friction against the wall of the tight shoe, throbbing violently at the end of the day. The visual is shocking, with the big toe overriding the others, destroying the natural anatomy of the foot and requiring, in severe cases, sawing the bone to realign the collapsed structure. Number 13. Heel spur. Imagine a solid bone thorn growing underneath your heel, piercing the soft flesh from the inside out every time you support your whole body weight on the floor. The spur is a rigid and pointed calcification that forms silently, the result of chronic tension in the ligaments, acting like an invisible nail driven inside your foot. The pain is deep and persistent, as if you were walking eternally on sharp stones, making it impossible to stand without feeling this bone needle tearing your internal tissues. Number 14. Gout. Your feet suddenly swell, turning red and hot like an ember, the result of uric acid microcrystals sharp as glass accumulating sneakily in the joints. The pain of gout is described as one of the worst a human being can feel, where even the light weight of a bedsheet touching the toe feels like unbearable medieval torture. It is the body failing to filter toxins, turning the big toe into a deposit of microscopic needles that cause a terrifying and incapacitating inflammatory explosion. Number 15. Poor circulation. When blood stops reaching the extremities, your feet take on a cadaverous purplish or bluish color, becoming icy to the touch even on the hottest days. The lack of oxygen in the tissues makes the skin thin, shiny, and fragile, signaling that the cells are slowly suffocating and dying from severe vascular starvation. Ignoring these signs of poor circulation can lead to wounds that never heal and, in extreme cases, necrotic darkening of the toes, a frightening prelude to amputations. Number 16. Diabetic neuropathy. The most treacherous danger is the one you don't feel. Neuropathy kills the nerves, allowing you to step on a nail or cut your foot without feeling absolutely any pain. Deep and infected ulcers can open on the sole of the foot and rot silently, exhaling a strong smell of infection, while you keep walking without realizing the hole in your own flesh. It is a devastating condition where the loss of sensitivity turns the foot into a biological time bomb, requiring daily visual inspection to avoid gangrene. Number 17. Unsterilized pedicure. That cuticle nipper that passes from client to client without going into the autoclave is a biological weapon loaded with deadly viruses like hepatitis C and HIV. A microscopic cut on the cuticle, often invisible to the naked eye, is sufficient to transmit serious blood diseases that will stay in your liver for the rest of your life. Blind trust in salons that just wipe alcohol on the instruments puts your health at mortal risk, turning a moment of beauty into an irreversible and dangerous viral lottery. Number 18. Skin peeling in large chunks. Sometimes, the chemical aggression of accumulated sweat or allergic reactions causes the sole of the foot to shed entire layers of skin, peeling like a snake molting in the wild. Large flaps of dead epidermis come loose, leaving behind a pink, moist, sensitive, and unprotected surface that stings upon contact with the rough fabric of the sock. It is a repulsive sight to see pieces of your own body detaching in the shower or inside the shoe, exposing the fragility of the barrier that should protect us from the dirty outside world. Number 19. Fungal infection spreading to the groin. The athlete's foot fungus isn't content staying just down there. When putting on underwear, your feet drag these microorganisms directly to the groin. The hot and humid environment of the genital region is paradise for this mycosis to settle, creating red ring-shaped spots that itch madly, peel, and cause total embarrassment. It is the disgusting proof that a lack of foot care can contaminate other intimate parts of the body, spreading the fungal infection through the simple act of getting dressed. Number 20. Tight shoes. The vanity of wearing pointed toes crushes the toes, forcing them to bend permanently like animal claws, unable to stretch back into the natural position. The toe joints become prominent and rub against the roof of the footwear, creating painful corns and chronic wounds on top of rigid and irreversible bone deformities. Over time, the tendons shorten and the toes lock in this grotesque position, destroying the foot's balance and aesthetics, all in the name of a fashion that mutilates your anatomy. Number 21. Lack of proper washing. Many people just let soapy water run down their body in the shower, forgetting to actively scrub the stuffy space between their toes with their hands. There, a gray and moist paste accumulates, made of sock fabric remnants, dead skin, dried sweat, and street dirt, fermenting day after day without being disturbed. This basic hygiene negligence creates the perfect habitat for chronic bad odor and infections, turning the gap between your toes into a biological waste bin that you carry to bed every night. Final thoughts. Now that you know the microscopic horrors and visual deformities that might be hiding inside your footwear at this very moment, your foot hygiene will never be the same. If this video gave you chills or taught you to take better care of your health, subscribe to the channel for more visceral content and leave your like to support our research work.